In the operating room, the surgical technologist is an integral part of the surgical team. Sometimes we're so close to the action, we have our hands on and sometimes even in the patient. Now, a lot of you are saying, ooh, no, gross, that's not for me. But some of you are like, that's kind of cool. You're our kind of people. So what do you need to do to get such a cool job? Do you have to go to school for surgical technology? Do you have to be certified or licensed? Well, the answers to those questions get a little complicated. The reason it becomes complicated is because the answers really depend on where you want to work. Now, please know that from here on, the information will pertain only to the United States. Other countries and regions have their own rules, and I don't know enough about them to speak with any authority. Remember that nurses used to be the ones who directly assisted the surgeon. But as more specialized knowledge and skills were needed, the role of surgical technologist split off from nursing and became its own profession. With that split came a push to require specialized training for new surgical technologists, and there are several ways of obtaining that specialized training. Nurses and others who have served in this type of role previously were grandfathered in and may continue to act as surgical techs today. Many people receive this type of training while serving in the military, and this training is usually accepted. Some hospitals offer in-house training, but the majority of new techs today receive their training through a specialized program, usually at their local technical or community college. There are also a few universities and several private or community schools, and even some online services that offer surgical technology training. Of these programs, most of them are accredited. Now, this means they're monitored by a national agency to make sure that they're doing a good job of teaching all the things that a tech would need to know. Two agencies, KHEP and ABHES, provide accreditation specifically for surgical technology programs themselves. Sometimes the school or hospital where the program's held may be accredited by any number of agencies, but the surgical technology program itself may not be. Then when you complete your studies, you can sit for or take a big national surgical technology exam, and if you pass one of these exams, you become certified. There are several organizations that offer certification in surgical technology. Of these, the National Board for Surgical Technology and Surgical Assisting, the NBSTSA, is probably the one you'll hear about the most. Not only is it the largest SurgTech certifying organization, it's also the most exclusive and the most restrictive. Only students who graduated from a KHEP or ABHES accredited program can sit for the National Board exam. If you pass this exam, you'll be designated a Certified Surgical Technologist, or CST. And just like doctors have MD or DO after their names, and nurses have RN or LPN after their names, you'll be able to place the letters CST after your name. The NBSTSA focuses solely on certifying surgical technologists and surgical assistants. The second largest certifying organization is the National Center for Competency Testing, or NCCT. The NCCT offers many different tests and certifications for many different allied health specialties. Surgical technology is only one of those specialties. Because you don't need to have completed a KHEP or ABHES accredited program to take the NCCT exam, this certification can be a good option for people who have been in the position for a long time and are now being told they need to be certified, or for students who have completed a program that isn't accredited or is in the process of seeking accreditation. Many techs who are trained on the job, either through the hospital's training program or through an online program like MedCerts, can also become certified via this route. If you pass the NCCT exam and meet their case requirements, you will be designated a Tech in Surgery Certified, and you'll be able to put the letters TS-C after your name. There are a few other smaller certifying organizations, but these certifications are not widely known and therefore may limit the places you'd be permitted to work. Now, what do I mean when I say you might be limited as to where you can work? As best I can tell, there are 12 states that require new surgical technologists to be certified, and 10 of those 12 states, shown in blue here, will only accept the CST certification from the NBSTSA. This means that for a non-military person who wants to become a surgical technologist and work in one of these states, Pretty much your only route is through an accredited program and passing the national board exam. Now, Texas and Oregon are slightly different. In Texas, you still have to complete an accredited program, but afterwards, you could take and pass either the national board and get your CST certification, or the NCCT exam and get your TS-C certification. In Oregon, you can either graduate from an accredited program and then pass the national board, or you can take online courses and get on-the-job training and then pass the NCCT exam. Now, after the effect COVID had on healthcare workers, some hospitals in these states are trying to get around these restrictions by saying there simply aren't enough certified techs available to meet the need. But this is a very controversial move, and it seems to be pretty rare, so the rule generally applies. So what about the remaining 40 or so states and territories? Well, in these states, there's no law requiring certification. And some hospitals and surgery centers take this to mean that they can hire anyone for these positions.
Look, take over. Give me a clamp. Quickly, give me a clamp. Right, give me that. Here, take this, son. Finish this operation for me.
Yes, even people off the street with absolutely no training in sterile technique. Now, fortunately, that's actually rather rare, because while the states may not require certification, the hospitals themselves might, either on their own or with the encouragement of their insurance companies, the ones that cover the hospital when something goes wrong and they get sued. Now, why would they do this? Well, because the surgical technologist training is key to preventing surgical site infections, and surgical site infections are a common reason for lawsuits. So having qualified staff on hand who know how to maintain sterility is really a benefit to everyone. So let's see if I can simplify things a little bit. While it's technically possible to get a job as a surgical technologist without being certified or even without much training at all, if you want a better chance of finding work and you want a much better chance of getting to participate in the really cool surgeries, then certification is the way to go. And in many places, that can mean only the CST certification from the NBSTSA. Certification can often be your passport to job security and job advancement in this field. But of course, things can't be that simple, because with most certifications, you'll need to continue your education every year for as long as you're working. That means attending classes, lectures, or studying on your own, and then proving you continued your education by submitting records to the certifying body every 2 years. Now, if you were able to follow at least most of that, you'll probably do okay as a tech, because sometimes understanding this can be just as complicated as understanding all the instruments and steps involved in a total knee arthroplasty. So here's my take. Is requiring someone to become certified or even licensed before they're allowed to practice surgical technology a good idea? Well, think about this. The surgeon is licensed. The nurse is licensed. The anesthesia provider is certified. And just about anyone else who provides care to the patient during surgery is either licensed or certified. So shouldn't we surgical technologists be as well? Well, probably. But here's what really sells it for me. Robots. Using robots to help perform surgery wasn't even a thing 20 years ago, but these robotic devices have proven themselves to the point where they're being used in more and more surgeries. So think about what this means in the OR. To operate the robot, the surgeon is usually seated in front of a special console. They're not scrubbed in. They're not sterile. This means that more and more often, it is only the surgical technologist who is at the patient's side. It is only the surgical technologist who is scrubbed in and sterile. Everyone else must stay away. This means we're up there alone, with no one else nearby to catch an accidental contamination, and with no one else nearby who can jump in and act quickly if an emergency happens. Because of this, I think it is ever more crucial that the surgical technologists be properly and extensively trained and tested, not just for their knowledge of the surgical procedures, not just for their sterile technique, but to ensure that only those students who, under the watchful eye of a trained instructor, consistently demonstrated their ability to calmly adapt to changing situations and who consistently demonstrated their surgical conscience, their integrity, their ability to do the right thing even when no one is watching, that only those students be allowed to play such a critical role in patients' care. After all, if you were the patient, would you want somebody without extensive training and testing working with their hands inside of you?